Today's November 10th, 2021. This is the Program and Budget Committee. Let's call the meeting to order and start with the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. And now a reading of our mission statement. Megan.
Macomb County Community Mental Health, guided by the values, strengths, and informed choices of the people we serve, provides quality services which promote recovery, community participation, self-sufficiency, and independence.
Thank you. And now an adoption of the agenda. Is there a motion to adopt the agenda?
So moved. Support.
Motion by Megan, support by Selena. All right, all in favor signify by saying aye. Aye. All opposed? Agenda is adopted. Number 4, hearing of the public. This is the time for anyone from the public wishing to speak to this board. Is there anyone from the public wishing to speak? All right, number 5, request to approve. Purchase request for BSB Communications. Adam.
Yep, this is for our call center. As we've been talking about a lot recently, we've had a lot of growth both in our customer service department and in our managed care operations department. And to meet the need for the staffing, we want to purchase more licenses for them to be able to use the phone system. It's also for the Ignite system, which helps them track the calls that are coming through and identify where the callers are coming from. So this is to meet the capacity needs and the staffing increases that we've had recently. This is for 10 extra licenses.
Okay. Any questions? None? I know I forgot to ask for a motion. Is there a motion and a support?
Support.
Okay. Motion by Megan, support by Selena, or by Donna. Thank you.
I'm a big mouth.
Okay. All in favor signify by saying aye.
Aye.
All opposed? Motion carries. Item B, approval for the CMH member handbook, help when you need it, translated into Arabic.
So moved.
Support.
Motion by Selena, by Megan, support by Antoinette.
Yep.
All right, anybody, looks like it's Adam.
Yep, this is me too. This is for actually for Arabic and Spanish.
Okay.
We'll be translating it into. We did our 2017 community needs assessment, and it found that Arabic and Spanish were the two highest spoken languages for ESL. So to meet the requirements for our member handbook, which needs to be handed out, we're translating it into those two languages. You see there's 3 quotes here that are attached, and we're going to go with the lowest quote that's on there.
Okay. Any questions?
I have a question.
Yes, Linda.
A member, what's a member?
Member handbook? The individuals, the people we serve?
Okay,
Yeah.
so you call that, that's
Well,
the
person
term.
served handbook.
Persons-
Yeah.
Thank you.
You're welcome.
Any other questions? All in favor, vote by signifying aye. Aye. All opposed? Motion carries. Next item is about the laptop bags. Is there a motion to purchase laptop bags? Motion by Donna, support by Linda. Or Antoinette. Thank you, Phil. And this one is Dave.
So we are moving our office, and that's scheduled to be completed by December 6th. In conversations about trying to support our staff in coming back into the hybrid work model, there is a need to be more mobile than ever. Using myself as an example, I had some afternoon meetings that were here locally. I was going to take my 3 o'clock meeting in the office. I forgot my laptop at my house. Luckily, I live close, and I just took the meeting at my house. But I have a camera, a light ring, a laptop, things like that. And the staff will be doing the same thing. They'll have docking stations available to them, some shared workspaces. So to accommodate the hybrid work model, thought it would be appropriate to arm them with the needed necessary equipment to aid them in that task. Kathleen did the legwork and located the vendor that would put our logo on the bags, make sure it was appropriate, and that's what we'd like approval for. So we can purchase those for staff and the new hires as they come in.
I just have one.
Yes, Donna?
I assume this is just direct staff.
Yeah, it's our staff, yes.
I have a question as well, Dave. I noticed that it's a 15.6-inch bag. Will that fit everyone's laptop? I recently ran into this problem where my computer wouldn't fit into the bag, so.
Kathleen has some examples.
The laptop that most of us are issued, and the bag was found by our IT department, and it's really an incredible value. You can fit, I've unpacked, I've got piled this big of stuff in my car that I took out of the bag, so not to embarrass myself to show you how cold. But it's very substantive, and it was an incredible price point that we're getting that at. Usually,
Oh, it's a great deal.
I could find was cost 4 times as much, so it has still a bit of room. Somebody's saying it might not fit, but we found that most of them fit.
Okay, awesome.
Thank you.
Thank you.
Linda?
Just curious.
Does it have a shoulder strap too?
Yes.
I like a shoulder strap.
Me too. Any other questions? All right, all in favor signify by saying aye. Aye. Motion passes. Item D, MISD, this is for the contract services agreement with the 3 schools. Dave? Or is there a motion?
Motion to support.
Motion by Megan, support by Lori. Motion by Lori, support by Megan. Selena, thank you. Okay. I'm having a hard time hearing with this. Okay. Dave?
Under this agreement, we're actually the contracted entity, so we're contracting with and under the Macomb Intermediate School Districts to provide those school-based services for the sum of the $154,979. The service locations listed are the Nell Reed High School, Rockwell Middle School, and the Maple Lane Elementary. So we're providing staffing supports to provide those school-based, primarily prevention services and things to the school.
Can I just say,
Donna, yes.
I've worked at all 3 of these schools.
Get out.
This is where I started. I did my internship at Rockwell, and when I first started working for Macomb County, I worked at Neil Reed and Maple Lane. So this is where my heart lies, is at these MISD schools. So I am very supportive of
Okay.
this. This is my heart, are these MISD schools. So I am very supportive of this, extremely supportive of this. We actually used to have, not contracted, but actually full-time Macomb County employees, one each of these schools. And this is where I actually work, so, I really, really, really support the MISD school system. So, I actually worked in all 3 of them, so I'm very supportive of the MISD schools. Yeah, very supportive, thank you.
That's so cool, Donna.
Yeah.
Any other questions or comments, or? I don't think anyone can match that experience. All 3.
I worked in all 3.
All
I
in,
won't tell you my favorite.
okay. All in favor signify by saying aye.
Aye.
All opposed? Motion carries. Item 6, receive and file. Is there anything to receive and file? Nothing to receive and file. Are there any resolutions? No resolutions. Number 8, other possible agenda items. It looks like Stacy has an update, a PowerPoint.
Super long one, you guys.
Hey,
Pages, right? It's 4 slides with one saying thank you, so I really don't need time to with the time change and everything. I'm Stacy Coleman, I'm the Chief Privacy and Compliance Officer. We've had some changes in the department lately. I basically was thank you.
Is it better?
Much better.
I'm usually a lot louder anyway. With Cindy Conal leaving, I've taken over the responsibility of the quality department. We have 2 staff who had left that department for other positions that were county positions. So we will actually, then Cindy will be leaving as well as another county employee. So we'll be looking to do some reorganization in that department. So I'm now the Chief Privacy Compliance and Hearings Officer and / quality now. So it's going to be relatively busy. We're engaging in strategic planning for quality, looking at the functions that they actively engage in and how we can actually look to improve the person-served experience, the provider experience with our agency, and improve quality overall. Next month, you'll be seeing the Quality Assessment Process Improvement Plan. We're revising that plan. It will actually be much more targeted towards the key performance indicators. Macomb County hasn't done that well in those key performance indicators in the past, so we need to really step it up. And we're also, because quality was overseeing the introduction of NCQA accreditation to us, we'll be working very actively with them as well. Key takeaways: compliance continues to be active in local and regional activities. I will actually be presenting on compliance trends to the Improving Outcomes Conference in December with Macomb County, a Northern Michigan regional entity. They invited us back after last quarter's conference. They said, wow, we don't get to see the compliance people in quality, and they have such a great interface. 8 of the 10 PIHPs, or quality and compliance departments, are together. So they said, please come back. And so we're coming back and doing a presentation for them on December 2nd at their conference. I will not be traveling to the conference. They did offer us the virtual option, so I'm taking that one. One of the things we've noticed is that local appeals and Medicaid fair hearings still continue to go down in number. I've done my first Medicaid fair hearing in 3 months today. So we aren't sure of all of those reasons, but it seems to be something around the state that is happening. So when I ask other hearings officers, are they seeing that same trend as well? Our local appeals were averaging about 8 a month, which is very low. When I came here, you were averaging 132 hearings a year. I've done 19 this past year. Successfully upheld in all but 2 that were overturned for technical reasons. So we're making good decisions on the local appeals. We're making good decisions that we haven't had to overturn many of them. But we are refining our handouts that we provide to folks so that they're much more informative. We took the disability rights, it used to be the Michigan Protection Advocacy Program. We took their handouts, and I got permission to take what they had developed over 2 years and put that into our information. Our information was a little bit outdated, and it was a hard read. We want people to know, if anything, you can call our customer services and they can help you file a local appeal. That is going incredibly well. We have changed all of our notifications to say, if you want to file a local appeal, just call customer services. They will get you to us, and that has worked incredibly well with Chanel and her team. They're doing a great job fielding those calls. Other than that, got nothing for you. Do you have any questions?
Dave?
Through the chair, it's not a question, so don't be worried. The key performance indicators that Stacy's referencing, just to be clear, are timeliness of access to services and follow-up after hospital discharge, and our overall penetration rate, which is the number of people we're serving divided into the total number of Medicaid eligibles. We have not historically done well in those areas at all. So Stacy's comment about paying more attention to those, reorganizing, we are looking to impact those areas that have just haunted Macomb County for way too long. So we're looking forward to those changes. And thank you.
Thank you. You'll be seeing those in the Quality Assessment Process Improvement Plan. I'm focusing on the key performance indicators and steps the agency can make to improve those. So, anything else?
Thank you, Stacy.
Thank you.
CEO update.
Thank you. Kind of following up on Stacy's comments about presenting, we are doing really well about getting out and about. We were on the listening tour with Representative Stone, Linda Bush, myself, and Karen Wood from My Care were part of the panel. I think, if I recall, that Mark and Lori were also in attendance virtually. So thank you all for that. The Tracy Smith and I presented at, I'm actually using this as my cheat sheet. It's Michigan Coupa HR. Coupa is the college and university professional. So it's the human resource staff on the colleges and universities. Very nice group. Tracy and I presented on the mental health for the workforce, what to be aware of. Is it Sherma? Sherm. Yeah, with Ryan and Megan. And we were recommended from that presentation. So Tracy and I are starting our own speakers bureau and going out.
Still getting rave feedback, by the way.
And it actually, I moderated a session on mental health in the workforce at the Macomb Leadership at the ISD this afternoon. And thankfully, Tracy, our presentation I was very well prepared for that. So that was a new experience for me as well. And okay, so those were the presentations. Linda, I didn't know if you wanted to make any comments on the listening tour?
I did. It was, there were 2 mothers of people who received services and the legislative aide who's encountered Macomb County for a long time. And it was just so enlightening to see the changes in the reports from parents and from the legislative aid of improvements that have been made in Macomb County, particularly around the call center and recipient rights and response to complaints, or not complaints, but issues when they have concerns and so forth. So I just want to thank Dave for all the things that he's put in place, and staff and everybody who's participated in those improvements.
Thank you. We will be bringing to the board, hopefully next month, a request for an RFP for a jail diversion program. So it's something that I had one meeting that included Don Brown, the chair of the Board of Commissioners, something that the county executive is interested in, something that I think would be beneficial to Macomb County. So we'll get you that detail for review, and then hopefully get the RFP issued early next year. My schedule, I wanted to provide an update. It's crazy hectic. I will be checking in as much as possible, but I am off next week for deer season, which is an annual event. So anyways, I have that coming up, and for personal reasons, I need to take additional time off until I can relocate all of my belongings. So wish me luck on that. I will be, like I said, checking in and available to staff the entire time. So I mentioned earlier that our move is scheduled to be completed by December 6th. I think I've gone public before, but TJ Laporte has just done an exceptional job in coordinating the build out at the 19800 office suite, all of our move, and updating staff, keeping everything on track. We've had supply chain issues with all of the equipment and office supplies. TJ has taken that all on by himself, mostly. So really just a public thank you to TJ, and things are on track. And I think TJ mentioned that he plans to take some time off after December 6th. So he's personally motivated to make sure we are settled by that time. So we will hopefully be scheduling some time for the board to come out and see the new offices once everything's in place. So we're looking forward to that. And I think really that, the legislative committee met, and I took the notes, so I am responsible to get those minutes out. I have started them, and we'll get those out for the full board for that review. On the advocacy front, I was able to share just before coming to this meeting the Community Mental Health Association of Michigan's email about advocating, along with the video that was featured our clubhouse members, which was just very, very well done. So that went out to Christina Mozella to share with our providers, went to Helen Klingert to share with the MCOSA Oversight Board. I sent it to the current CAC, and I copied Adam because he'll be covering the CAC meeting next week. I sent it to, I think the full board got it, hopefully.
I saw it.
Okay. So we are pushing forward on that front, and I shared the office hours from Alan Bolter, the updated office hours, and we'll be making sure that's distributed as well. So we're continuing to push forward on that front, to work closely with the association. And we also have our Metro Region dinner scheduled. I did the draft agenda for that, got it to Sandy earlier today. So we are looking at a hybrid meeting. I am meeting with Thomas Cole tomorrow about the technology needed so that we can show the video at the Metro Region dinner, and that the people who are participating virtually will be able to see it as well. So should be a nice event on the evening of December the 2nd, and that'll be our Metro Region dinner. So thank you.
Megan?
Can I ask a question, Dave?
Yes.
I think that when we were at the conference, I volunteered for a committee, I believe. And there was that legislative committee, but I haven't received any information. Would that be through you, or is that, will I hear about that at the region, Metro
It's
Region?
from Monique. You'll get the information. Some stuff did come out on a legislative committee for next week, and I know I had to respond that I couldn't make it. I think it's the 18th.
It's the first meeting.
Till January, I feel
Yeah,
like.
so Monique Francis will be
Will
sending it
do
to
it,
you, and she
okay.
does have your email address, I already gave it to her.
Perfect, thank you.
Cool. Thank you.
Thank you, Dave. Phil?
Thank you, Mr. Chair. About 3 hours ago, at our Board of Commissioners Committee, we approved a contract with Plant Moran to start assessing our needs at the Health Department in the Verkulen building. And I know we have some services in the Verk building. I got a chance to talk to Tracy right before that meeting, and the board did approve that contract. We will do it at full board probably next week. But just so you're aware and Tracy's aware that it's just kind of a needs assessment sort of deal with people working hybridly, and the building is, I think they said it was built in the 50s or something like that.
Because they were talking about how the Mount Clemens Health Center is really old and needs to be demolished, and moving them into the larger building. So they're looking for the best use of this large, very large space that right now is mostly vacant, I believe. So it was approved to really go in and kind of diagnose this building and how it can be used, and can we close down some buildings that are not in good shape and move them in, or what's best, especially if people are going to continue with hybrid work.
And because CMH is a part of that, the executive's office and Plant Moran should be in contact with either Dave, Tracy, everybody to talk about moving forward during that assessment. So just wanted to make you aware that we did approve that to get that going today.
Bill did ask, have they been in contact, so they know that we're on it.
Always watching.
That
Thank you,
reminds
Phil.
me of another update. The advocacy information I did send to Crystal to be shared with the Board of Commissioners. When we presented our budget to the Board of Commissioners, there was two follow-up items. One was the information on conferences and trainings. The budget had increased. I did respond to them. After following up internally, it's primarily related to an increase in evidence-based practices and our work under the CCBHC model. So we're encouraging staff to do more training, get certified, doing some train the trainer, the case to care management. So that response did go to the Board of Commissioners. The other action item was to separate the interest payments from the substance use funds separate from the mental health. So when Richard presented, we had the interest payments all rolled over into the mental health fund because the substance use funds are very prescriptive, restricted on how they can be used. The Board of Commissioners asked that be separated. I've seen an internal draft that does that, and once that's been checked, I will be sharing that back with the Board of Commissioners as well. And I do apologize. I will forward all that information to the board members here too, so we'll all be on the same page. Thank you.
All right. Megan, do you have a comment?
I don't, no.
Okay.
It's just my face.
Hearing of the public.
I have another agenda.
Oh, you do? Oh, okay.
I just wanted to say that I had the opportunity to go to the Teacher's Pet event where
Thank you.
They adopt a pet and they train it and they work at the Humane Society. But I was able to sit next to a parent and a child after they got their certificates. And the mother said that the change in her daughter was just night and day from this relatively short-term assignment that they were project that they were involved in. So I just want to thank Agnes and staff for bringing that to our agency, and I think the intention is they do it again. They made point to tell the kids that the certificates that they got would be great for resumes and college and that kind of thing. So, but it was just a really heartwarming thing to witness. And then they took us in with the kittens, and that was really, that was hard to sleep that night without having taken a cat home.
You got tapped on the shoulder, didn't you?
Yeah.
By a cat.
Yeah.
I'm mean, I'm so mean.
Thank you all for going, the board members that went.
It was great.
All right, hearing of the public. Is there anyone from the public wishing to speak?
Hi, my name is Carmen Zimmerman. I'm the Director of Creative Care Services, 34360 Harper Avenue, Clinton Township, Michigan, 48047. Thank you for your time, and I'm here tonight just to talk about the concern of the CLS respite and per diem rate that Macomb County offers the provider for reimbursement for the services. My concern is that we have such a shortage in staff as it is, and we're competing with our neighboring counties, which are paying at a much higher rate, and the staff want to go there and work as caregivers instead of staying here in Macomb, and you can't blame them because they want to make as much as they can for their service that they're providing. So just an example of the rate, CLS in Macomb County currently is $17.68, and Oakland County is $21.64. So Oakland County is able to pay their staff a little bit more than we can. The per diem rate is $100 less here per day than any of the other counties. So please, I'm asking you, will you take a look at that and see what you can do to help your providers here in Macomb County remain stable and in this county? Thank you.
Thank you. Is there anyone else from the county or from the public wishing to speak? No one? And that moves to number 10, but before we go to number 10, I just want to remind everyone that, Thursday is, tomorrow is Veterans Day, and to thank everyone that's served, and I know Megan, your husband, has served, and thank you for all the family members of those who have served as well. So, and with that adjournment, is there a motion to adjourn?
So moved. Support.
Support, motion by Linda, and, what? Did I screw that up?
It was me this time.
It was? Okay.
She always does.
All right. It must have been an echo. Motion by Megan, support by Selena. Okay. You pointed, Lori, and it threw me up. Okay, motion by Megan, support by Selena. All in favor signify by saying aye.
Aye.
We're adjourned.